So, how do we handle when a new patient, emails us a very detailed email with all kinds of questions? Can you help me with this? What kind of nutrients should I take? What do you think about this? Should I see this kind of doctor or that kind of doctor? How do I handle those kinds of emails? I'm Dr. Russ Rosen. I help natural healthcare providers just like you thrive in a care versus care, true optimal health model. So I was just having a conversation with a doctor that I coach. He happens to be about 90 days waitlisted, and he gets all kinds of emails asking all kinds of very detailed questions, and he wanted to know how do I best handle those. So I figured I would just record this if you find yourself in the same situation and if you find any value in this. So the trick is this. It A, it's something that is really simple answer, like, can you help with this kind of problem? And the answer in the email would be absolutely. That's my specialty. This is my bread and butter. This is what I do all day long. And just give them direction. Go ahead and set up a time, set up a free consult, set up a phone consult, a telehealth appointment, whatever it is. But there doesn't have to be a whole lot, just real clear on that. Now, it might be that they're asking all kinds of detailed questions. How much vitamin C should I take? And should I do this particular exercise? And blah, blah, blah. Should I see a different kind of practitioner? The whole trick here is to acknowledge that that's a really great question and just let them know that, that's a really great question. And the truth of the matter is, for me to answer that, I need to know more. How much vitamin C should I take? It's a really great question, and it really depends on so many different factors. Should I be doing this particular exercise? Really great question. If you're doing this kind of exercise before you're stable, it could really cause more problems. After you're stable, could really help things, et cetera, et cetera. So I don't have time to go into all of that, and I don't know enough information. So all I have to do is acknowledge that's a really great question, touch on whatever it was that they mentioned, as far as a nutrient or a different doctor, et cetera. Just touch on that, saying, lots of different variables really depends on a few different things. Can I make a suggestion? Right? I need to know more about you. I need to know more about your case. I need to know more about what's going on with you to give you an appropriate answer. So can I make a suggestion? And then just give them direction. Click on this link and set up an appointment. Give this number a call, set up an appointment. Set up a free consultation. Set up a phone consultation, a telehealth consultation. I have a tremendous program on phone consults or telehealth consultations. And then just let them know why. So go ahead and do this so we can really clarify specifically what's going on with you and what the best path forward would be. Okay, so those are really just a few of the really simple things you can do. What I don't want to do is find myself spending hours answering all kinds of super detailed questions. And the truth is, you're not serving them because you don't know enough. So if it's something simple like, can you help me with this kind of problem? That's what I do all day long. Go ahead and do this. Or more detailed questions, great question. I need to know a little bit more so I can really best help you. Can I make a suggestion? Go ahead and do this so we can get together and I can find out more and I can give you an appropriate answer. I can give you a next best path forward. So I hope you found value in that. If so, please let others know. If you want to thrive in a care versus care true optimal health model, I can help you do that. Just comment below or flip me an email. We can set up a time where you and I can talk and I can help you figure out your best path forward. As always, much love and aloha. Bye, gang.